All right, let's tell you a little more about what's going on in Hassan. 4 deaths, in fact, in one day that have taken place in Hassan district in Karnataka. Let's tell you about the victims here. Lepakshi, age 50, the resident of JP Nagar, collapsed after complaining of fatigue. Professor Mutaya, age 58, lecturer at Government First Grade College, died of a heart attack while having tea. Kumar, age 57, D Group employee at the Chanarayana Tana, passed away after hospitalization for chest pain. Satyanarayan Rao, age 63, resident of Rangolihali colony, collapsed after chest discomfort. I'm being now joined by Dr. Naresh Trihan, chairperson, and MD Medanta, the Medicity, is the most authoritative voice as far as cardiac health is concerned. Thank you so much for your time, Dr. Trihan. I want to begin by asking you about your observations about what you're seeing in the state of Karnataka, in Hassan district, a sudden surge, or is it that because the numbers are startling in the last 40 days or so, has this got the government really compelled to set up a committee to look at the situation? Is there a silent epidemic that we are yet to acknowledge?
You know that we have talked about it for many
Hmm.
years. The fact that India has one of the highest incidence of heart disease. If you compare it to the West, say the Caucasian population, our incidence of heart disease in India is about twice that amount. So if it is 5% in the US and Europe, it's about 10% in India. So
Hmm.
that's the baseline from which we start. So there are many causes that we have actually investigated. Many studies have been done from around the world, and wherever our populations are there, whether it is Chicago, whether it's London, or whether it's somewhere in Europe, what has happened is that we find that our community, diaspora in these countries, also has a higher heart disease incidence than the population of the surrounding area. So that means that we have a genetic propensity to have a higher incidence of heart disease. That is one. And a lot of it has to do with our lifestyle and our diet. Our lifestyle, as you know, with automation, more and more people are getting to be like couch potatoes. They do not look at their weight, where they are gaining weight, just happily eating whatever they find. And that's been one big issue. That's why we have the highest population of diabetics also in India. So, and if you have a combination of both diabetes and heart disease in the family, then the children will have double or triple the chance of developing heart disease. So that's why we say today, know your genes. If you know that in your family there is history of heart disease, you also know that in your family there is history of diabetes, then that person, the children of that family, should be checked before the age
Hmm.
of 25 for the risk factors that are associated with heart disease and diabetes. And if we detect it early enough, and today genome sequencing is also completed,
Hmm.
so we can actually see the genomic footprint of each individual. In other words, if we know all the facts about the biochemical, the physical, and the genetic makeup of an individual, we can write the horoscope of their health.
Hmm.
So if we know in time that these pre-existing things are there already, then we can actually warn the people of how what their lifestyle should be, what are the things that they have to be careful about, and the fact that they can mitigate the risk of heart disease and diabetes if they are careful.
Hmm.
So that's why we say 25 years, or by 25 years, children of families which have diabetes, heart disease, or both should get their full checkup done.
Okay, Dr.
For the
Trehan,
test,
I want to ask you. You've spoken about these preventive checkups. So what should be the basic test that what one should be doing? And you're saying that if you have a predisposition, you should be doing it from the age of 25. What about others who do not have a predisposition?
then by the age of 30, the first checkup should be done so
Okay.
that we know what the risk factors a person is carrying.
Hmm.
Now, for instance, I'll give you an example. We did a study of 10,000 executives who came for their preventive checkup. And we found that a full 26% of them had high blood pressure, which they didn't even know about. So the fact is that if you know that you have high blood pressure, you know that your lipid profile being cholesterol and all its subfractions, that they are abnormal. If we know that the history of blood sugar is getting to be high by HbA1c that we check, then we can actually warn these people that these are the diseases that we know that they have a higher risk for.
Mm-hmm.
So, like I said, if your risk of developing heart disease is double of what your next person is, then we can always warn them that they cannot indulge in eating rich food. They must exercise. They must also get preventive checkups in frequencies that we define for each individual.
Mm-hmm.
So there are methodologies that we know that we can do all these tests. And now there are even people who we suspect maybe have getting the beginning of heart disease. We can do CT angios, which is a non-invasive test, and actually screen them.
Okay.
So all these things have actually developed so much so that today, if a person actually goes for a checkup and it's not very expensive, that a lot of preventive work can be done for them,
Mm-hmm.
and hopefully we can actually prevent diseases from developing.
Okay.
So that is basically the crux of this whole problem that we are facing today
Okay.
in our country, in our population, anywhere around in the world, that we are have a higher propensity. Now we also must clarify that all heart disease is not blockages of coronary arteries, which
Mm-hmm.
are most commonly known as causing heart attacks.
Mm-hmm.
You can have abnormal heart muscle. You can have holes in your heart which you don't know about. You can have irregular heartbeats which you don't know about. And you may have an unstable electrical system which you don't know about, because all these things can cause sudden death. And that's why I think it's important that in this current environment which we are existing,
Mm-hmm.
where there is not only the risk of overweight, diabetes, heart disease in the family,
Mm-hmm.
but there is also a lot of stress. There is
Yes.
environmental stress, there is work stress. You step out of your house and there is noise stress. So we are exposed to a much different environment today than it used to be 20, 30 years ago.
Mhm. That's why, Dr.
So
Naresh Trihan, people who are ostensibly fit, working out at a gym, look healthy, look fit, are succumbing to heart disease because stress is silent. It's not something that you can see. I mean, if you have cough and cold and if you're down with fever, you can see it. But stress is something mostly that gets missed, isn't it?
So that's exactly what my point is, that when we do a full checkup on an individual, we also do their stress profile.
Mm-hmm.
And we can also tell them that according to their profession, how they should manage. Like if you will see, too many people are getting back pains. Too many people are getting neck pains. So that is especially in today's people who are into the IT world
Mm-hmm.
and working on computers all day, which most work conditions require today, that they have this problem with the physical structure being put under stress. If
Mm-hmm.
that is the case, then you warn them, and then they can actually correct their posture. They can elevate their laptops or iPads or whatever they are using, and that's basically the thing that they people should be aware of. That continuous working on computers also causes a lot of headaches, a lot of eye strain, and like I told you, neck pain and back pain.
Mm-hmm.
So these are other lifestyle diseases that actually are taking a big toll on our
Mm-hmm.
population, and
You
the
know,
younger people are more
yes.
exposed to it because of the irregular working times, also lack of sleep.
Dr.
So
Trehan, I also want to, go back to what has been said very, very recently, just a few moments ago by the Karnataka Chief Minister. And this is the question that everybody has been asking. The link with the COVID-19 vaccine. I mean, this is something that has been ruled out by the Indian Council of Medical Research on the possible link between heart attacks in younger population and the vaccine. Please tell me if I'm wrong. If there were these side effects that were to be seen of heart attacks, would this not be 3 years ago? Will it be seen now?
I'll tell you that we have observed very distinctly that people who got serious bouts of COVID actually had inflammation in their hearts. 20% of them showed their reduction in their pumping of the heart. They showed inflammation signs of the arteries around across their body. And they are the ones who may have become victims of heart attacks because of the fact that this inflammation left their arteries of the heart damaged.
Okay, okay.
Now, back to we do not have any documentation, and like you said, ICMR has actually addressed the issue
Mm-hmm.
to say that look, there is no real evidence found so far, especially when the ones that were used from India, that were developed in India, that that there has been any correlation between the incremental increase in heart attacks in those people. Yes, there were a few reports in the US and in Europe also, which said that the mRNA vaccine, which was the one that was developed in the West, that some people did get cardiomyopathies or irritable hearts from that. Yes, that has been reported, but it is never really documented that it happened in large numbers.
Mm-hmm.
So I don't think it's fair to blame vaccines for it because there is no clear evidence that this has happened.
Mm-hmm.
We
Okay.
also know that people who did get vaccinated, and this is something well documented around the country, that the people who did get vaccinated, their degree of severity of their COVID attacks were less, and the people who actually had comorbidities and they were not vaccinated were at the highest risk.
Right.
So these are facts that were worked out during the pandemic, and now we have a clear-cut idea that the methodology by which Indian vaccines were developed, and that was actually attenuated virus, that is the dead one. That virus does not cause that much inflammation in the body. That mRNA, which was a good mRNA vaccine, was new,
Okay.
not long enough, so may have caused some problems.
Right. So Dr. Trehan, I also want to ask you, basically what you're saying is that COVID has an impact on your heart, has had an impact on your heart, but not the vaccines. That, at least not the vaccines that have been made in India or basically given to our population. That is something that needs to be clarified and put out because it's a charge that we've often seen, being made that these were the vaccines that essentially are leading to these long COVID impact.
Well, this is what I'm trying to say is it's not it's there is nothing documented. I mean, as being a doctor, a man of science, we always look for documentation of any events that may have happened. And then you can actually extrapolate whether something has done any harm to your body or not. The very basic fact which everybody may or may not know about COVID was that COVID was initially thought that it only causes lung problems. Then there were autopsies done on victims of COVID in Italy, and those autopsies are from the people who had passed away from it showed very clearly that the inflammation was caused by the virus in every part of the body,
Right.
and especially the arteries. So if you could find the virus in the kidneys and the liver and the brain everywhere in those autopsies, it proved the fact that it is not limited to the lungs. It actually transmits through the vascular system to the rest of the body. And that's why that reaction that people have had, where we have seen documented at 20% of the people who got severe COVID showed some signs of inflammation in their heart. And also
Right.
some people passed away from that.
Dr. Trehan, I also want to ask you, the case of Shefali, of course, the postmortem report is awaited, but could there be possible links between, low blood pressure, the fact that she was fasting and taking medications? Of course, we have to wait at the end of the day for the postmortem report. But is there a possible link between anti-aging medications, glutathione being taken on an empty stomach through IV, or, low blood pressure? Talk to us about where the science stands on that.
So, it's irresponsible to make statements on things that have not been proven. This is speculative. Let the autopsy report come out. We will know some more facts about what happened to her body. Of course, it's a very tragic death and a young person. And we are seeing this happening because there are many, many causative agents that can cause this. So not knowing the facts, I don't think that any person who's responsible, a responsible doctor, should be commenting on it or speculating on it. That's not a responsible thing to do.
No, no, my question to you was just about taking, medicines on an empty stomach, on that and low blood pressure. That's what I was trying
No,
to ask
see,
you.
look, any artificial material taken unnecessarily can cause harm. All medicines, all vitamins taken inappropriately can cause harm. So that is why unsupervised administration of these things by people who may have no proof of that the efficacy of something is not a responsible act for any doctor to do or any individual to take.
Right.
So if you're taking your responsibility without the knowledge in your hands, it's up to the individual, but it is not the right thing.
All right.
And that's all, and all the more reason I think that this prescription of certain additives to a human for whatever reason, artificial reason, I think is irresponsible if there is no proof that it works.
That's right. All right.
And
We, of course, yes, doctor. Yes.
okay,
Yes.
so all these serums and all these cosmetics which claim so many things, 99% of them don't work.
Right.
So, and billions of dollars have been made on these false promises.
Right. Dr. Naresh Trihan, appreciate your time here. You put the focus on this important issue of heart attacks, the heart health epidemic really in the country. Several questions being raised on what could have happened to those victims in Hassan in Karnataka. Why are just so many Indians succumbing? Dr. Trehan putting the spotlight on why preventive health checkups are just so mandatory, especially when you have a predisposition. Appreciate your time here, Dr. Naresh Trihan.
Well,